All right, so what we've got here is our freshly slaughtered and skinned rabbit, which we're going to use as a model for that basic organizational plan of really any mammalian body, including, of course, a human. And what we're looking at is that outer tube of the body, the trunk from the pelvic region, the abdominal, the chest region, or what we call the muscle, skin, and bones part of the body that wraps around the outside. The limbs are nothing more than muscle, skin, and bone projections out from that outer tube of the body, both the lower and upper limbs, or hind limbs and forelimbs on the rabbit. And what we're going to be doing is cutting through the muscular abdominal wall and then through the muscles and also the ribs or the bones of the chest wall, opening up, exposing the inner tube of the body and opening up what we call the coelom or the body cavity. In an embryo, in the adult, what would be the abdominal cavity down here, inferior or caudal to the diaphragm, and up here the chest cavity, superior or cranial to the diaphragm. So I'm just going to start by cutting into the abdominal cavity. And I'm just cutting right through that muscular wall of the abdominal cavity, the oblique and rectus muscles, so that we can open up or get into the coelom. And I'm going to go all the way up. I can feel the diaphragm up there, so I'm just going to cut all the way up to the diaphragm, right up there. And then I'm going to make some flaps so that I can see off to the side all the way around like this. And I'm just cutting down inferior to the ribs here. And this then would be that muscular abdominal wall. And on its interior surface, you can start to see that sheeny, nice sheeny, saran wrap serous lining. What down here would be the peritoneum, in this case, the parietal peritoneum, because it's part of the parietal or somatic or outer tube of the body. And the same thing if I open up on the other side, making those nice big flaps so we can really see everything that's in the abdominal cavity. And again, there you can see coming up off that internal, you can see the abdominal muscle, and the thin saran wrap-like lining is going to be the parietal peritoneum that wraps on the inner surface of the outer or parietal part of the body. And it's pretty tightly adhered. If it were a younger rabbit, I might be able to get it off, but you can see that nice sheeny layer that's on there on either side. Now, what I've got inside here, we're not going to worry too much about the details of the intestines, because in a rabbit, they're very much different than the human intestines, because they are strictly vegetarians and mostly eat leaves, and they harbor a whole string of intestines that are just to harbor bacteria that help them digest the cellulose in the food that they eat, which we don't have. So this is all intestines down here. You can see this is a lot of what we would call mesentery fat, or that visceral fat that we hear so much about in the press that surrounds the saran wrap lining of all of the intestines. And then if we look at the cranial end, and if we zoom in right in here, that we're looking on the inferior surface of the diaphragm. See the muscle of the diaphragm? And when that muscle contracts, when that muscle pulls inferiorly, that's what brings air through the trachea down into the lungs. And you can see it connects all the way around the outside of the ribs. The biggest organ in here, the big dark organ, is the liver with its various lobes. And if we look on the underside of the liver, we're going to see the part of the liver that temporarily holds bile, what we call the gallbladder, between meals, ready to send that bile into the stomach after the animal eats. You can see there's some of those mesenteries again, or saran wrap linings. That even covers the liver and everything in the abdominal cavity. That would be part of what we call the lesser omentum. There's that flappy sac there, very dark looking flap on the underside of the liver, which is the gallbladder full of bile. The bile that the liver produces collects there, and then it goes through this little duct here right into the start of the intestines, right here. Just to show you this. This is the stomach. the J-shaped stomach. It's got the greater curvature over here, the lesser curvature of the stomach here. That's why that's the lesser omentum there. And where the stomach meets the start of the intestines, it's all covered in fat here, but this would be the pyloric part of the stomach right here, the pyloric sphincter, and you can trace that bile duct from the gallbladder straight down into right where the start of the small intestines are, and that first part of the small intestines forming a C over here on what would be the right upper quadrant, because remember, this is the right side of the animal. That's the C of the duodenum. So the stomach, the big J of the stomach, dominates the left upper quadrant, and then you come over to the C of the duodenum, and then, like I say, the rest of the intestines we're not going to worry so much about. That's basically what fills the rest of the abdominal cavity. So just to get oriented again in the abdominal cavity, there's the J of the stomach, the big liver, and just as an added bonus, along the greater curvature of the J, that's the spleen right there, which is it's a site where immune cells develop and are housed in the adult. And this big piece coming off of here would be what we call the greater omentum, a whole big piece of mesentery that drapes over the intestines. Isn't that beautiful how you can see that? I can also show you all this nice mesentery. All the intestines connect at the back body wall, and if we hold this up, you can see the blue of my glove between there, and that's just that beautiful connecting mesentery between the outer part of the body, all the blood vessels, see the blood vessels and nerves coming off of the aorta and the spinal cord coming out to the different parts of the intestines through that mesentery. That's how they get their nerve and blood supply. And then the intestines themselves are covered with what we would call visceral peritoneum. Again, that thin, sheeny, saran wrap-like layer that covers everything, absolutely everything in the abdominal cavity. If we go back, we saw our spleen here along the greater curvature of the stomach, and if you come back and we look at where the stomach meets the small intestines at the duodenum, and we have a very diffuse pancreas in the mesentery. There's not a whole lot of it that you can see, but you can see kind of angling back towards the spleen, this diffuse gray glandular tissue in the mesentery. That's the pancreas in there. So one last thing to see in the abdominal cavity, here's all of the intestines that, of course, we're not worried about the layout in a rabbit because it's so different. But if we move all the intestines aside, remember, here's my outer tube of the body, my muscular wall of the abdomen with parietal peritoneum. It's covering over some fat that's laid under the parietal peritoneum, and here's where I've cut through that fat, and I can see the kidney on the right side. The kidneys are visceral organs in the sense that they're under autonomic control. We think of them as being part of the sort of autonomic functioning of the body, but they really form in the outer part of the body from a very special tissue called the intermediate mesoderm, and that's where they are into adulthood. We recognize that in English by talking about the kidneys against the back body wall, and if somebody gets a punch back there, we call it a kidney punch. Or for Spanish speakers, people talk about me duele los riñones when they have what's probably a backache in the muscles of the back, but they're recognizing that it's located in the same place where the kidneys are. And if we go ahead and dissect them out a little bit, you can see how I have to take the there I'm pulling away the parietal peritoneum, or that serous lining, away from the kidney, and now you can see the whole kidney on the right side. Its blood vessels would be coming off here, connecting back to the midline. And if I go to the other side of the body, I should be able to see the kidney on the left side as well. Again, here's my left body wall. Here's all of that saran wrap-like parietal peritoneum with overlaying all of this fat that's actually on the outer part of the body. And if the kidney is almost embedded in the fat in this case. There we go. So you can see it's against the back body wall. If I peel away the fat there's a nice view of the kidney on the left side, and you can even see the blood vessels coming into the kidney there. Okay, so once again, we're using our rabbit, recently slaughtered and skinned, as a nice surrogate or model for the basic organizational plan of a mammalian body, including a human body. And what we've done, we've cut through the outer muscular tube of the body down here in the abdominal region and opened up the coelomic cavity, or in the adult we would call this the abdominal cavity, to see all of the internal intestines, the liver, the stomach, and all of that. And now what we're going to get, and what I want to remind showed you is that right here at the cranial end of the abdominal cavity, you can see the diaphragm forming that seal around the inferior margin of the ribs, sealing off what's going to be the chest cavity. The chest cavity also has its outer, the chest region has its outer tube with its bones. The skin has been removed, but the skin, muscle, and bones, now we do have bones, we have the ribs here, forming that outer tube, and we're going to continue our cut up into the chest region, opening up the coelom in the chest region. In this case, it's going to be the chest cavity where we're going to find the heart and the lungs. So if we continue our cut anteriorly, right along the midline, or I'm actually going to cut a little bit off to the side, right up into the chest, you can see I'm cutting through what are mostly the cartilage and cartilaginous ends of the ribs. And I'm going to try and see if I can open this up in a way that you can appreciate the diaphragm as I do it. So here's the diaphragm. Probably, I could cut around the sides and the diaphragm will mostly be in place, and I'm just cutting the diaphragm away. See, the diaphragm is a thin piece of muscle. See, I've got it held in between my gloved fingers, and I'm cutting it away from the undersurface of the ribs on this side so that we can then look inside the chest cavity. And what I'm going to do, I'm going to cut as far forward as I can, and then again sort of make a flap off to the side. Of course, I have the upper limb to contend with here as well, but if I cut off to the side here and kind of break the ribs back, you'll be able to see pretty well into the chest cavity. Now, the thing in the chest, I'm looking in on what is the animal's right side. This is the lungs that we're looking at. This is the lungs here. And in the middle is the heart. This is some fat that's in the pericardial sac, or this piece of mesentery or serous lining that just surrounds the heart. And there's the lungs. And here's the internal surface of the ribs here is where you still see that same serous lining. In this case, it's now, because it's in the outer somatic or parietal part of the body, it's the parietal pleura. But because we're in the chest cavity, so I can get my probe just under there, I've got parietal pleura lining the internal surface of the ribs. And then on the lungs themselves, remember the lungs form the visceral part, the internal organs, again, very tightly adhered, but you can see how there's like a sheeny layer on there. I've got the visceral pleura in this case because I'm in the pleural or chest cavity. Now that's what it looks like on the right side. And I'm just going to, in the chest cavity, we're going to tend to have more blood because the heart is in there. And I'm just going to drain out soak up some of the blood. And what I want you to appreciate is that the heart has a piece of serous lining that connects it to the ventral or the front surface of the ribs. And in order to see into the other side of the chest, what do I have to do? There's looking in from, here's my liver, I'm looking in from the abdomen, and there's now the left side of the left side where the diaphragm connects to the undersurface of the ribs. Again, the diaphragm is just that thin muscular layer that when it contracts, when those muscles pull inferiorly, they suck air into the lungs. And if I just cut along the inner surface of the ribs over here, now I'm going to be able to look up into the chest cavity on the left side. There's my lung on the left side. And you can see the two sides of the chest cavity are separated by what is a ventral mesentery, a connection from the ventral or the anterior body wall, really right onto the surface of the heart, right down the middle. And so in order to really open up the chest cavity, I kind of have to tear away that ventral. I'm just going to tear it away, and now I can see the entire chest cavity. And if I pull back my ribs, I'm going to just break the ribs back considerably so that you can really look in here and see the whole thing. So that's really nicely opened up like that. And now I can really see the heart in the middle, inside its special layer, its own surrounding serous lining called the pericardial sac. It has a lot of fat on it, as you can see, and then the lungs on either side. So now I can really see quite clearly that entire organizational plan of the body. If you want to think of it this way, I have my muscular outer tube, the abdominal wall, and the chest wall, or the parietal or somatic part of my body, that forms that muscular tube around the outside with the limbs just being growths off of that muscular tube. And then I have going down the middle my visceral tube forming the esophagus, which we'll take a look at later, going into the stomach and the intestines, the lungs, the liver, and the pancreas all being ventral growths off of that tube going down the middle. Of course, the intestines get all twisted around, the stomach gets twisted around, but it still started from that original tube going down the middle, and the space between them that I've cut into is that sacred coelomic space, or in the adult, it would be the abdominal cavity, inferior to the diaphragm where the stomach, liver, and intestines are, and the pleural or chest cavity superior to the diaphragm where the lungs and the heart are located. Everything is coated with that nice serous lining, that saran wrap layer. When it's on the outer part of the body, it's the parietal lining, parietal peritoneum down in the abdomen or peritoneal cavity on the inner surface of the muscle, parietal pleura up in the chest cavity on the inner surface of the ribs. It then connects at the back. Remember, I've got the mesenteries going out to every single loop of intestines. When I hold up any one of these loops of intestines, I can see that nice, thin, sheeny mesentery. It all connects back to the back body wall. And in fact, in the chest, I can even see back here how the saran wrap layer comes out along the midline and then covers the lungs. And so now it becomes visceral, covering the lungs, in the chest cavity, covering all of the intestines, the stomach and liver and everything in the abdominal cavity. It's very hard to pull off of the organs, but it's now visceral peritoneum down in the abdominal cavity, visceral pleura covering the lungs. And that then is my basic organizational plan of a mammalian body, including a human body.